Hi, everybody. I'm Anthony Mato from Memorial Sloan Kettering Cancer Center. I am pleased to be with my friend and colleague, Dr. Jennifer Woyach from the Ohio State James Cancer Center. And we're reporting on some really interesting data and abstracts that Dr. Woyach presented at the ASH meeting. The first topic I want to talk about today is what we call a trial in progress presentation. These are presentations where the physician is really excited about a clinical trial that's ongoing but hasn't yet reported data. And you presented an interesting comparison at the ASH meeting. So I was wondering if you could explain to the patients all about that study.
Yeah, absolutely. So the trial in progress is the Alliance A041702 study. And this is actually the successor study to the previous trial, which compared Ibrutinib regimens to chemoimmunotherapy in older patients with CLL. So this trial is focused on patients with CLL who are age 70 or older, who are receiving their first treatment, and patients are randomized to receive either Ibrutinib plus Obinutuzumab or Ibrutinib plus Venetoclax plus Obinutuzumab. Those patients who are on the IO arm, so Ibrutinib, Obinutuzumab, will then continue Ibrutinib indefinitely. Those that are on the triple therapy arm undergo a response assessment after a year of treatment. And if they're in an undetectable minimal residual disease complete response, they stop all treatment. And if they're not, they would continue on Ibrutinib. So the study is designed to investigate this strategy of defining therapy length based upon response. And so we're going to look at the progression-free survival difference between those two arms. This is a very large study, again, designed to be a definitive trial of these two regimens. And so the study is projected to complete accrual in August of 2022. So then it'll be likely 3 to 5 years before we actually have the final comparison, but we're going to be very excited to look at those results over time.
So Jennifer, if a patient is excited about this, they're interested in this frontline trial, can you just explain what the Alliance is and how someone might be able to participate in this study?
Yep, for sure. So the Alliance for Clinical Trials in Oncology is one of the large cooperative groups in the country. And there's 3 main ones that serve basically all of the United States in terms of their membership. However, whenever we run large phase 3 trials like this, we go through something called the National Clinical Trials Network, or NCTN, which allows any patient at any site that does clinical trials to potentially enroll in this study. And actually, the study is open at over 700 centers in the United States. So if you are a patient who think you might be eligible for the study, it is definitely open somewhere near you. And you can find out where on clinicaltrials.gov and just look up the study number A041702, or you can look it up by keywords and it will list all of the sites that have the study open.
Thanks for that explanation. I think we hear sometimes about ECOG or Alliance, and it's a little bit confusing for patients, so that really helps. Well, thanks again for leading such an exciting trial, and in hopefully 3 to 5 years, we'll be together again and we can go over the data. Thanks so much.
Sounds great. Thanks.